when someone says, are they going to drop? Like,
Yeah.
are they going to stay where you put them, or how are they going to end up? How do you...
Okay, that's a really
patient?
good question too. You know, a breast implant, in my opinion, should be in the position that it's going to remain in when the surgery's over. When the patient leaves the operating room and goes to the recovery room, that breast implant ought to be where it's supposed to be. Now, once in a while, if there's some fluid accumulation in the pocket where the implant is, maybe there's a little bleeding, that can float that implant up just a little bit, and it might be just a little bit higher on one side. But, you know, and that implant will need to be given a little bit of time to come back down just a little bit. But for the most part, when an implant is grossly too high, or obviously too high, relative to the nipple position and that sort of thing, then I think that's a technical error on the part of the surgeon, frankly. And I think it's a planning error. I think that the surgeon, among other things, needs to know how much room he needs between the nipple and the fold for that implant to sit properly. Depending on the type of implant you're using, if you're using an anatomic or a teardrop, or what they call a shaped device, which is sort of a dumb word, then you know, that implant, the point of maximum projection of that implant needs to be behind the nipple. So if it's a round implant, the point of maximum projection is going to be through the center of the implant, and the doctor needs to know how low that thing needs to be positioned without being too low.
Yeah.
For the center of the implant, or the point of maximum projection, to be behind the nipple. Likewise, with a teardrop shaped implant, I think it's an upper 2/3, lower third. That intersection of the upper 2/3 and the lower third is basically where the point of maximum projection of that implant is, and that needs to be appreciated.